The critical role simple telehealth plays in practice management growth. What critical role does simple telehealth play in practice management growth? The pandemic accelerated the telehealth industry by years, showing practice groups how to keep patients and providers safe. Throughout 2020, the healthcare industry learned to optimize its telehealth practices through trial and error. However, now telehealth is no longer a short-term strategy for reactive care. Patients are demanding the convenience of telehealth across all demographics, while provider expectations for a telehealth platform are beyond simple one-on-one interaction. Where does this leave telehealth in a post-pandemic world as a key communication method for practice groups to leverage operational efficiencies and increased reimbursement events? As practice groups are seeing more patients in person with vaccinations on the rise, this creates more of a need for a long-term telehealth strategy. By utilizing telehealth beyond basic interactions and implementing hybrid models, healthcare organizations are achieving 150% ROI in less than 90 days, and on average 20% operational efficiencies. I will break down how simple telehealth best practices to achieve these metrics in a post-pandemic world. There's a higher demand for telehealth. Telehealth has grown by over 1,400%. All patient demographics used telehealth during the pandemic, not just tech-savvy millennials. Now the demand for virtual care plays a key decision in choosing a healthcare provider. During the pandemic, the use of video communications outside of healthcare for school, family visits, work, and fitness elevated the training of video technology. Let's look at the stats. It is estimated that telehealth visits save patients 1.5 hours compared to in-person care. 51% of survey respondents stated that their top reason for using telehealth is convenience. The global market for patient monitoring and telehealth increased by more than $2.8 billion in 2020 to reach $54.5 billion. Now, what is the difference between proactive versus reactive care? Telehealth has been primarily used for reactive care throughout the pandemic. However, the win-win for providers and patients are using telehealth what it was meant for in providing proactive care. Proactive telehealth is most beneficial for patients and providers in these ways: senior care, remote patient monitoring, nephrology, chronic care, and OB/GYN. Reactive care has been the primary use of telehealth. In an effective treatment for low acuity needs, however, that only scratches the surface of what virtual care was intended to do. By only providing reactive telehealth care, practice groups are not taking advantage of the full ROI. Reactive care provides treatment for allergies, cold/flu, UTIs, rashes, and behavioral therapy. Don't be tethered to physical locations. At the beginning of the pandemic, healthcare facilities were scrambling to find a viable video telehealth platform that would assist during the pandemic. Some medical industries ended up settling for video conferencing, free solutions, or basic telehealth through their EHR providers. Now, administrators have more requirements for the long-term telehealth platform to meet the needs of the medical group and patients. To learn more, download the white paper, The Critical Role Simple Telehealth Plays in Practice Management Growth by One Touch Telehealth from onlinewhitepapers.com.